This segment of DelmarvaLife is brought to you by TidalHealth.
Right now in the U.S., there are more jobs than workers. Some of us have come to accept it, whether you see it in restaurants or a department store.
And it's also seen in the U.S. healthcare industry. The American Hospital Association estimates the industry will need to hire at least 200,000 nurses a year to meet rising demands. Well, it's a task TidalHealth is on. Lori Lee is a workforce development manager for TidalHealth, and she joins us this afternoon. Thank you for being here.
Glad to be here.
All right, so yeah, we see it everywhere. Are you seeing it at TidalHealth?
Absolutely. We're no different than all the other healthcare entities in our region, but we are changing our approach at keeping it very multifaceted, doing things that we probably haven't done in the past to attract healthcare workers, definitely not just nurses, skills, as well as trying to introduce people to what all the careers that are there. We're trying to make a very strong presence on social media and all the job sites that others are using now, but we also are going to our potential employees, going to not only our local colleges, but quite a distance away to go where the jobs and the career paths that these colleges have that we need, as well as going out to our middle schools and high schools. Our general public, as well as our school kids, don't know what all the career possibilities there are. So we want them to start thinking about it.
Sure.
What gifts, what paths they enjoy in school, and how that could possibly be used in a healthcare system.
It's so important because you don't know that when you're in school, how you can actually apply what you're learning or what you want to be.
Absolutely.
So when you're looking for skilled people, specifically your recruitment team, do they have any other avenues or any other places that they go?
Well, we have all kinds of ties with higher education partners, our local schools, of course. We have worked with them and say, okay, we need to develop a program. We don't have anything local. Could we possibly partner together? We're using scholarship and all kinds of loan repayment and living stipend programs, things we've not had in the past to help someone who might be in school, can't work full time. We can help you get there and grow.
Yeah. Now, we've heard that TidalHealth is a city within a city, so obviously there are a lot of different jobs and different skill types. Can you talk about how many?
We are just shy of 5,000 people within our system now that it is TidalHealth Regional. But the reality is, whether it's that skilled person, the nurse, the radiology, the respiratory, but guess what? If I don't have facilities and security and storeroom and business and accounting majors, as well as people that are gifted in those areas, it doesn't work. Everyone is essential to that. So that is a great point to bring up to people. The one young girl said, I don't do blood and guts. I can't work in a hospital. I said, good, because there's about 500 jobs that have nothing to do with that are needed every day to help the healthcare system run like it should.
Yeah.
Tell us about some of the events you have coming up.
Well, we're doing some on-site events, so you can come check out potential sites to work, whether you just come to find out what there is to do there, or you want to come ready to start that interview process. We have some on-site events at our medical partners' offices every Wednesday in June from 10 to 2, and then at TidalHealth Peninsula every second Thursday of the month from 3 to 5, and at Nanticoke every fourth Thursday of the month in June, July, and August. So if you go to TidalHealthCareers.org and look under career events, it gives you the exact location and the address to just come talk to us in whatever stage. What is there, or let's get started with this interview process. We're ready to meet you.
They can get started right now. Lori
That's
Lee
right.
with TidalHealth, thank you so much for coming in today.
Glad to be here. Glad to be here.
Always good to have you.